My name is Sam Louie. I'm a professor at the University of California, Davis. I've been there for over 40 years, and I'm here to share my experience with the SmartVest. Patients don't come in with an absolutely clear indication for chest wall oscillation. They come in with non-specific symptoms, cough, sputum production if they even look at it, shortness of breath. But probably the one thing that prompts me to think about SmartVest and chest wall oscillation is a chronic cough, defined as a cough lasting more than 8 weeks. I may be very different from a lot of my colleagues. I actually have found these handheld PEP devices to be useless. And I keep recalling the conversation I had with Dr. Solomon at the University of Alabama, Birmingham, and he taught me that I haven't really achieved airway hygiene without doing the SmartVest. So SmartVest, best by test. I've tried the other vests in my clinical practice, and my patients prefer the SmartVest. So they've taught me what works for them. They like the SmartVest because it's very comfortable to wear. The oscillation is not difficult to tolerate. They do cough afterwards, but I think it's just the design. I will resort to a SmartVest very early. I think it's first-line therapy, not second, not third-line therapy for patients with bronchiectasis. I am not a big advocate for hypertonic saline. In fact, I tell my colleagues to prescribe it, try it yourself, see if you like it. But with SmartVest, it's not only simple, but it's effective, and it basically will not have any of the side effects of hypertonic saline. I think bronchodilators are still going to be helpful, but I really discourage a lot of my colleagues from using inhaled steroids. But I see a mistake made often, again and again. They use combination inhalers, and there's always a steroid in it, and you don't want a steroid in it because it can change the microbiome of the airway. But with high-frequency chest wall oscillation, you're going to take care of the microbiome because you're draining the pus from your lungs. You know, the phlegm becomes sputum, and you're getting rid of it. And the only way to get rid of it is to have an effective cough. So when you add a SmartVest to the patient's cough, you can be assured of success in reducing symptoms and warding off future exacerbations. But the problem with a lot of my colleagues is that they don't see high-frequency chest wall oscillation as a viable tool because they know nothing about it. And so this is why I think this is an area that we need to receive more education. We need to share our experience. And in doing so, we help our patients live healthier lives. It's about protecting the patient and preventing future exacerbations and continued decline in lung function. Antibiotics are more important, but antibiotics carry side effects. All drugs are poisons. As far as I know, the SmartVest has no known drug side effects because it's not a drug. It's my experience is that it really is an integral part of the patient's management of the disease. So much of what we do today revolves around chronic disease management. We really should be talking about chronic patient management. And this is where the SmartVest really comes into play, because you can treat the disease, but you got to treat the patient. The patient's cough is not helpful. You can treat the disease, but if the cough with antibiotics isn't getting any better, then you're no better off than you were at the beginning. It really looks like a vest, but it's so much more than a vest. There's advanced technology in the mechanism for high-frequency chest wall oscillation. And once you explain that to the patient, they're more likely to give it a trial. I tell all my patients, I'm no more than a shoe salesman. I have to find the right pair of shoes for them, be it a drug, a biologic, or a vest. But again, my experience has taught me that SmartVest is best by test.